Good morning, everyone. Good afternoon if you are above us. I'm in our time, and then good evening for those who are joining us from other places. So today we are here to celebrate the Menstrual Hygiene Day, a pre-celebration, and for our rundown today, we will be giving a short presentation on the menstrual hygiene. And then we have two guests. Mr. Pier, can you please show the slides? So we are the official partner of the Menstrual Hygiene Day celebration. And for today, apologies for the technical difficulties we are facing. So this is an awareness day that is celebrated on May 28 to highlight the importance of good menstrual hygiene management at a global level. It was initiated in 2014 by a German NGO called Wash United in 2013. So let's learn for some new words, but I don't see children over here. Do we have children participating? Can you please show your videos? Terms that we wanted to share with the children. But since I don't have them with us right now, I think I will just skip this portion and we will share the presentation with the schools. So this is about the menstrual cycle that we wanted to share with the children. And the changes that happen during puberty. We also want to include boys together with the girls because normally it's only the girls who are being taught, but we need to engage the boys as well. The changes in the male and female bodies we want to highlight. And what can be done to reduce pain during the periods. And what are the essentials for MHM? So from here, can I ask Mr. Pier to continue?
Sure. So yeah, basically we just wanted to go a bit. I mean, first of all, really thanks everybody for joining and apologies for the technical issue we have been facing. And I think it's affecting also the participation. As mentioned by Dr. Vinita, we will share the recording with our schools and the presentation as well. I think if we didn't start joining the recording the session, probably if everybody agrees, we could start too, so that we can share it with children from the programs where we are working. So I also wanted to say that today we have two special guests that have joined us from two non-profit organizations that are contributing to reduce the stigma around menstruation and promote solutions to raise awareness and also end periods poverty through education, tailored products for specific communities, and partnership at the local level to ensure that girls, students, women can really be living in a, and all the people that have menstruation can live in a period-friendly world. We have two colleagues from REMI and Period Power that will share their experience and their mission in a little while. So first we wanted to give a look around the world and we are using some data from a joint monitoring program report with a focus on menstrual hygiene management, covering the period for 2023 and 2024. That shows us a bit the situation of how people are living menstruation, accessing education, accessing products, and living in an enabling environment for thriving in their life during menstruation. It's interesting to see that we don't really have global data, but more snapshots on different countries. So we will show you some information from countries that give us a bit an overall picture on the situation. I know that also Nevada Brown from REMI with her team, they have conducted researches around these topics, and maybe she will share also information later. This is just a very quick information that tell us that from a study that was conducted in 2018 in Bhutan, let's say data shows that only 1 in 5 schoolgirls who have their periods had correct knowledge of their fertile period. So this talks to a lack of, let's say, basic information and education for girls that is really harnessing the capacity to access an enabling environment for menstruations. Next slide, please. There are also studies that focus on how menstruation has an impact on, let's say, the way girls experience school attendance and how they are enabled to fully participate to school life during menstruation, and shows that schools around the world are not still providing the enabling environment for girls to be able to continue normally their day-to-day life during menstruation. For example, in Ethiopia, 1 in 3 students who menstruate wait until going back to home to change their menstrual material. So this talk to a discomfort that girls are bearing during their menstruation at school, probably because schools are not equipped with safe spaces or clean latrines to allow them, let's say, to perform basic hygiene practices during menstruation at school. Next slide, please. Also, another snapshot tells us that in general, many adolescent schoolgirls do not have enough menstrual material and many struggles to afford them. This varies very much in terms of context and countries, but I think it tells us that there's still a lot to do when it comes to have a period-friendly world. Next slide, please. Also, going back to education and enabling environment, information about menstruation, it comes out that many adolescent schoolgirls change menstrual materials less frequently than recommended, and this can have an impact on girls' health. So there's really a need to escalate the work we need to do in terms of both of share health and hygiene information, but also ensuring that girls have a safe, clean, and private environment where they can perform hygiene practices. Next slide, please. So these are just some ideas on what a period-friendly world can mean for us. It means to be able to get comprehensive and timely information. It means to have access to safe, private, and well-equipped facilities. It means to just acknowledge that menstruation is a natural process that our body performs like on a monthly basis. It means to have access to menstrual material, hygiene and health. And when we talk about menstrual material, we talk about the right menstrual material that is the best for people experiencing menstruation. It means also to live in an environment that support girls and women at home, at school, in day-to-day life during menstruation. Yeah, we can go to the next slide. Just one note to say that we don't have much data around the impact of menstruation on enjoying on girls being able to fully participate to school life during menstruation, because most of the information focus on absentees, but this doesn't capture the fact that girls can really have a hard time to fully participate to school activities during menstruations, even they're there, and even if they attend school, and that these can really result in a great discomfort and uneasiness for girls. So when we are talking about a toilet that features MHM-friendly components, we are talking of clean toilets, toilets that are private, that have a door with a lock, that have access to water, to soap, that have bins for collection of menstrual hygiene management, that are accessible to people with disability that might have mobility issues or any other kind of disability that might impact in their capacity to access latrines. Ideally, in some schools, toilets are provided with vending machines with menstrual products or free menstrual products. So these would be, I would say, the minimum requirements for a toilet that is MHM friendly. So I think it's good also for students that are attending the call to think of the toilets they have in their school, and if they meet these kind of requirements. If not, I think it's time to advocate with teachers and with your school management to really ensure that the toilets of your school can provide basic facilities for menstrual hygiene management. Next slide, where we will see, yeah, okay, this is a picture of an accessible toilet with people that might have mobility issues. Next slide, please. We have talked a bit about what it means, let's say, to live in an environment with barriers to menstrual hygiene health management, and this is even getting worse for vulnerable or marginalized groups in emergency situation or in certain settings where, again, there might be lack of private facilities, lack of information and education, lack of, let's say, ways to manage menstruation, especially in emergency situation, in situation of extreme poverty or displacements, for example, conflict related displacement. Facilities might not really be designed to be accessible for everyone. Menstrual material might not be available, and on top of that, there might be a lack of social support and also the presence of cultural taboos and stigma that might even constrain the environment for menstrual hygiene management. Next slide, please. So this set of circles shows how from harmful beliefs and taboos about periods, we can really let's say, grow the barriers and challenges around menstruation and menstrual hygiene management with restrictions on menstruations or on things that women and girls can do during menstruations, which is making worse existing gender inequalities and gender norms linked to patriarchy. There's always in these environments also the willingness to keep menstruation away from public life, create a shame around menstruation, which is just a natural process. And overall, this is resulting really in people being unable to access basic rights around health education, accessing water and sanitation facilities, or opportunities and dignity. Next slide, please. And just one small discussion around bullying, because I think we are talking with school students, and unfortunately, menstruation can be also a topic around bullying. There can be situations in which girls are made ashamed during their period. And again, this is on top of all the difficulties that girls have to face during their period to attend schools. So this is really a call for all the children, all the students, to really avoid and report any behavior that result in bullying girls that are going through their period. Yeah.
Can I add to this, Mr.
Sure.
Pier? Yeah. So what we want to promote is let this not be an education only for the girls. We keep the boys together with us, and they, take it as it's a normal process. We should, bring changes in their thinking, and then also we should not encourage the bystanders, because bystanders are also equally a part of bullying if they do not report what is going wrong in the school. So, Mr. Pier, shall I go with the next slide?
Yes, please. Also, just a reminder about something that I think is very important for children in school, and it's linked to 5 body safety rules that we should be aware of. So first one is that my body is mine. So I'm mastering my body. I'm the boss of my body. And let's say I don't have to be hugged, kissed, or touched by anyone I'm not comfortable with. I have private parts, so we don't look, touch, or play games with each other's private parts. Everyone has private parts. So, and we use the proper name for our private parts. They are not weird or funny. Everyone has them. Again, they are part of our body, and they are part of the natural process of our life. The last one is that the fourth one is around secrets about private parts. There are no secrets about private parts. No one should be asking to keep a secret, especially if it's about private parts. And also the fifth one, and is very important, is that there's a safety circle for my body. So I know at least 5 people I can talk to when I'm sad, when I'm scared, and especially if I need to talk about body safety. So if someone breaks a body safety rule, there's the need to have someone helping me and to tell to the persons in my safety circle about what's happening. even if I didn't tell it right away. There's not a timing, let's say. And again, you will not be in trouble, and it's never too late to tell and to seek for help. So as you can see, there's still a lot that we have to do for a period-friendly world. And I think everybody of us has a role in contributing to a period friendly world. So let's see what we can do to make it real. We can go to the next slide. So for girls, the idea is that really you need to have access to information on MHM and puberty, and you need to have space, clean, safe, and private space for your hygiene practices during menstruation. One of the suggestions is also to eat well during your period, because it helps your body to be strong during this time. Also be confident and ask help when you need it. And also be very confident taking part to school, social, and religious activities during your period, because your period is not influencing, let's say, your ability to participate to these events, or is not having any impact in these events. So feel free to live your life normally, because menstruation is a normal process. Next slide, please. So boys also have a very important role, because boys need really to understand puberty and need to understand what menstruation and menstrual hygiene management is. They are very important actors that can really create a good environment around people that are experiencing menstruation at school, in their free time, in day-to-day life. So you have to actively support girls in challenging situations during menstruation, and support your female classmates during their period. Then, of course, there's a role for the adults, parents, and guardians. They should be the main educator of adolescent girls on MHM before the first period. They're supposed to care, to support girls during menstruation, to teach them and to encourage them to stay active during their period, and also to provide this information for boys. Teachers has a crucial role in the education and information about menstruation for girls. Also, they are the ones that can create an enabling environment to discuss MHM among stakeholders, and to create a safe filters also to ensure that stigma can be discussed, and just we can run over them. Yeah. That's all I would say. We have a nice video if we have time, or otherwise we can go to our guests to listen from them and from their
Yes.
experience.